Hi, I'm Rick Gillespie-Mobley. I have served as a pastor and as a lawyer for decades. You are going to be bombarded with a lot of information on commonly known as the abortion amendment. A lot of what you are going to hear is not going to be true. First of all, abortion is legal in Ohio. It will be legal in Ohio whether Amendment 1 passes or fails. The difference between Amendment 1 and the current law is whether there should be any restrictions at all on abortion. There is a time limit in the current law as to when an abortion can be done, except in the case of rape or the mother's life is in danger. Amendment 1, or Issue 1, what it wants to do is to push the limit for abortion all the way up until the moment of birth. In other words, there will be no restriction time-wise, and the abortionist is the person who decides whether or not a child would be viable outside of the womb before doing the abortion. This would make Ohio one of the most extreme positions on abortion anywhere in the country. If you have not made up your mind yet on Issue 1, I ask, would you please consider watching this short video so that you can see what really happens in a late-term abortion. There are many people who are in favor of abortion, but they are not in favor of abortion up until the moment of death or birth. I want you to listen to this doctor who has performed over 1,200 abortions himself as he explains what really happens during the abortion process when the child is almost fully developed in the womb. Thank you very much for your time. I just want you to make an informed vote when you do vote on Issue 1. Thank you.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician-gynecologist, and I performed over 1,200 abortions. Finally, I'm going to describe a third trimester-induced abortion, which is performed at 25 weeks to term. At this point, the baby is almost fully developed and viable, meaning he or she could survive outside the womb if the mother were to go into labor prematurely. Because the baby is so large and developed, this procedure takes 3 or 4 days to complete. On day 1, the abortionist uses a large needle to inject a drug called digoxin. Digoxin is generally used to treat heart problems, but a high enough dosage of digoxin will cause fatal cardiac arrest. The abortionist inserts the needle with the digoxin through the woman's abdomen or through her vagina and into the baby, targeting either the head, torso, or heart. The baby will feel it. Babies at this stage feel pain. When the needle pierces the baby's body and the digoxin takes effect, the life of the baby will end. The abortionist then inserts multiple sticks of seaweed called laminaria into the woman's cervix. They will slowly open up the cervix for delivery of a stillborn baby. While the woman waits for the laminaria to dilate her cervix, she carries her dead baby inside of her for 2 to 3 days. On day 2, the abortionist replaces the laminaria and may perform a second ultrasound to ensure the baby is dead. If the child is still alive, he administers another lethal dose of digoxin. The woman then goes back to where she is staying while her cervix continues to dilate. If she goes into labor and is unable to make it to the clinic in time, she will give birth at home or in a hotel. In this case, she may be advised to deliver her baby into a bathroom toilet. The abortionist then comes to remove the baby and clean up. If she can make it to the clinic, she will do so during her severest contractions and deliver her dead son or daughter. If the baby does not come out whole, then the procedure becomes a D&E, a dilation and evacuation, and the abortionist uses clamps and forceps to dismember the baby, piece by piece. Once the placenta and all the body parts have been removed, the abortion is complete. Late-term abortions have a high risk of hemorrhage, lacerations, and uterine perforations, as well as a risk of maternal death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.